Hey everybody, this is Cameron Dennis. I'm a physical therapist with Back on Track Therapy and Wellness. Welcome to the Back on Track Healthy Living podcast. So today we're going to be talking about rotator cuff physical therapy versus rotator cuff surgery, right? Because there's multiple options here. If you have a rotator cuff tear, I guess so you can do nothing, because a huge percentage of people have rotator cuff tears and they don't even know. They might not even have any pain. But if you do have pain or you have difficulty lifting your arm over your head or lifting things over your head or pulling or pushing, those types of things, it's possible you have a rotator cuff tear. Um, and so what should you do, right? If you can do some type of rehab, I'm just going to be upfront. That to me is going to be the first step in the process. And I actually do have some studies here that I want to go into as well. And I'll be brief, so I don't want you to think we're going to go into some crazy deep dive on these studies. They're important implications for someone who may be considering having shoulder surgery that I want to talk about with those. So anyway, let's talk about what it looks like to have the rotator cuff surgery versus not have the rotator cuff surgery. Um, if you do have partial tears, because you could have either a complete tear of one or multiple of the four rotator cuff muscles, or you could have incomplete, which means that it's not a total tear, it's just partially torn, right? Um, and the idea is that if you have the surgery, um, generally it's going to be arthroscopic, so they're going to use like a scope to do it. They're going to make you or have you be in a sling for that shoulder for anywhere from 4 weeks or greater. Sometimes it's a little less if it's a really minor tear, but generally speaking, the medium to larger rotator cuff repairs are generally going to be in a sling for at least 4 weeks. Um, and then you'll be doing what we call passive range of motion during that time and pendulums. So pendulums are just kind of moving your arm in a circular motion. If you look at on Google, you can see what Codman's exercise is or a pendulum. But anyway, they're very basic exercises, but you really are not supposed to be using those muscles at all for at least 4 weeks if you have the surgery. After that, the rehab generally starts, anywhere from the day after the surgery, anywhere through like for after like 6 weeks. It just depends on the surgeon and how much they want it to heal on its own before they do the therapy. But if you have the surgery, you are going to have extensive physical therapy. There's really no way around that. And it's a good thing because if you don't, there's a good chance that you will re-tear or you'll never restore your range of motion or strength. And so, you can have the surgery, but just know you're going to have to do anywhere from like 4 months to 8 months of physical therapy afterwards. Um, and so, the other piece of that is that it is quite painful. I'm not saying that, that it's not doable or that you shouldn't ever do it. There are definitely cases when you should. And that's something that between you and your doctor, maybe your physical therapist or your family can talk about, like whether you're able to have, be in a sling for that period of time, or is there someone who can drive you because you will be on pain meds for some time. They say shoulder rotator cuff surgeries are probably one of the most painful orthopedic surgeries and rehab that really you can go through. And when I'm saying that, I'm speaking about the most common ones. I would say knee replacements are probably next on that line. Um, so anyway, I get this question all the time. I have a rotator cuff tear. Do I need surgery? Can therapy help? Let's examine the science and the actual experience. And we did talk about the experience of what it's like to go through the surgical aspect of it. And the non-surgical generally will be you come in for a physical therapy evaluation. They're going to find out if your range of motion is normal. So how high can you get it? Can you reach behind your back? Can you reach behind your head? Things like that. They're going to help you restore your range of motion. And then also, um, once you've restored range of motion, then they're going to work on your strength. And generally speaking, that will be done below shoulder height to start. So They'll do rotator cuff specific exercises generally, but to me the important part is like the functional part, like the push pull types of things, reaching behind your back to pull your pants up, all of those things. And then once you can get good at that, you can start to strengthen over the head because that's a little bit harder on the rotator cuff. I would say much harder on the rotator cuff. And so you want to make sure that you can tolerate strengthening below the shoulder height before you start above the shoulder. Um, so that's kind of what the therapy looks like. And depending on the situation, it can be anywhere from a couple of weeks to, up to 6 months of rehab. It really just depends on the severity. And generally speaking, if you're not making progress, so I don't want people to think that you're stuck doing it for 6 months and not making any progress, and oh my gosh, I could have had the surgery in that time. If you're doing your therapy and you're being compliant with what they're asking you to do, and you're showing up, and if you're making progress, they'll keep you in therapy until you reach your goals, right? But if you're not making progress, then generally speaking, they will then refer you to an orthopedic surgeon to say, hey, this person probably is not, they're not responding well to physical therapy. Um, you know, can you evaluate them as a potential surgical candidate? So that's what the therapy aspect of that sort of looks like. Um, so let's look at the studies here, okay? First study, I'm going to read the title. Surgery and physiotherapy were both successful in the treatment of small acute traumatic rotator cuff tears, a prospective randomized trial. Rainbow et al. 2020. So their findings, they found that there was no significant difference in clinical outcomes between cuff repairs and non-operative treatment at 12 months follow-up. So that means that both the physical therapy and the surgery were both successful at helping the person return to normal function at 1 year following whenever they did the initial assessment for this study. Um, they did also find, though, that approximately one-third of the unrepaired patients had a tear enlargement of more than 5 millimeters. And that to me is interesting. They aren't really clear about the cause of the tear enlargement. So is it possible that this is something that would have happened whether they were doing physical therapy or not? Because generally speaking, most physical therapy is going to be conservative, especially up front, and the risk of tearing or worsening a rotator cuff tear in physical therapy is quite low, unless you're, somewhere that they're hyper aggressive and they're not listening to, they're not looking at your function, they're not really looking at, your symptoms. The communication maybe isn't there. So they don't really say whether or not the person was receiving physical therapy, the people were receiving physical therapy or not, or whether or not they would have had these tear enlargements happen without it. Um, anyway, so I'm not saying that it couldn't be caused by that. I'm not saying therapy couldn't cause that, but we just don't know. So um, anyway, study number two, when should we repair partial thickness rotator cuff tears? Outcome comparison between immediate surgical repair versus delayed repair after 6 month period of non-surgical treatment. Kim et al. 2018. So basically, what they found was there was significantly superior outcomes in patients who received non-surgical treatment, such as physical therapy or injections prior to having rotator cuff repair surgery. Um, so basically, they're getting at the immediate surgical repair is not required, and actually, people who wait 6 months to have surgery and receive physical therapy do significantly better after they do, and even after they have the surgery. So basically, what I'm getting at is, if you know you have a rotator cuff tear, you don't have to have it surgically repaired right away. Give it time, give your body time to heal, because like I said, they're super common. Give it time to heal and potentially try some non-operative treatments. So my suggestion generally is if you can tolerate daily living, if you can tolerate exercise and physical therapy without steroid injections, that will be probably the number one way to go. If you have trouble tolerating it, if it's really painful and you're having trouble doing daily activities, my suggestion would be probably have a steroid injection and then do physical therapy because in that way you can better tolerate what they're asking you to do to facilitate healing of those muscles and structures. Um, so you have, they're basically what they were saying was, if you wait 6 months to have surgery and you do conservative treatment, you do better than if you just have surgery right after you tear it. So very interesting, I thought. So study number three, surgery or conservative treatment for rotator cuff tear, a meta-analysis by Ryosa 2016. Um, they basically said, and this one I thought was pretty interesting. No evidence that surgery is more effective at improving pain and function over physical therapy after 1 year. So the implications of that would be that PT should be attempted first. So that should be the first thing that you do if you're having shoulder pain and you are found to have a rotator cuff tear. They should do the physical therapy prior to the surgical treatment. And they're saying because the two treatments are essentially having the same outcomes after 1 year. So basically, whether you have surgery or whether you have the physical therapy for 1 year, you end up about the same. You end up doing a lot better with your pain and with your function. And the reason they're saying that PT should be tried first is because of the reduced risk of complications such as infections and blood clots, negative side effects of anesthesia or pain medications, things of that nature. And also, it's cheaper. So physical therapy is going to be a lot cheaper than even a single surgery. Not to mention that if you have the surgery, you're going to end up with physical therapy, extensive physical therapy afterwards. So anyway, I know that can be a little bit dry for some people talking about studies, but I think it's important that we look at the actual research and not just base our um, base our decisions on how we're feeling. Like frustration, for example. Sometimes, you've been dealing with an injury for a long enough time that, you're frustrated. You want the quick fix. You're like, somebody just fix this thing, and actually what they're saying is that that's actually not a quick fix, right? So the quick fix doesn't exist for rotator cuff tears. You can do things to help reduce the pain. So dry needling, cupping, manipulations, exercise, all of these types of things can help reduce the pain, massage, and then physical therapy to improve function. So, hopefully that all makes sense to everybody. Just to summarize it in one sentence or so, I would say if you have a suspected rotator cuff tear, go find your physical therapist. If you're in the Lima area, come see us. We'll do a thorough evaluation of your shoulder and your overall function. We're going to help you get back to living your normal life, and feeling like yourself again. And if we can't help you, then we will then forward you to who, we suggest in terms of a surgeon, for either injections or potentially to get evaluated for surgery. So anyway, hopefully you found this useful. If you did, share it with others who may be dealing with something similar or who may find it useful. Um, Make sure to subscribe to the podcast. And we do try to do these every week. I will say I was sick the last 2 weeks, so I couldn't do it. And I believe in 2 weeks I have an interview with Dr. John Laux. He's a chiropractor in our area, and we've been trying to do this for a little while, but he's a real busy guy, and so am I. So hopefully we'll have that set up. And there's a couple other people I have to get set up for interviews as well, because I want to kind of dig in and kind of see what they're all about and how they treat and what they find important and what they would like to change about the healthcare landscape. So this is Cameron Dennis. I'm a physical therapist at Back on Track Therapy and Wellness. Thank you so much for listening, and I hope to see you later. Take care.